Thank you. Sean Moody will start with the next question. The Fund for Healthy Maine is currently restricted to 8 specific purposes. What, if any, additional purpose would you approve for the Fund for a Healthy Maine? And are there any purposes you would propose to delete?
Thank you. Well, I'd start by saying those are all very critical. And let's get something really clear. We're in this position in Maine today because we haven't invested ourselves properly in the past. So there's a difference between a tax increase and an investment. And you're going to hear that as a common thread with me. I am very frugal, you can call me tight. I'll shut the light off before I leave the room. But when it comes to investing in our future, there's a difference, very distinct difference. The Fund for Healthy Maine is imperative. It definitely would not take away from any of the initiatives. It'd actually be in favor of adding to them. We got to look at our aging population. Increase the prescription drug discounts for our elderly. I think that would be a good initiative to include in there. Another thing I think is important is dental care. That's becoming increasingly important. You folks, you know, this is your area of expertise. Gum disease, you know, dental care is so extremely important for our young, you know, from a self-esteem standpoint. And let's face it, if we get these youngsters headed in the right direction with a good, healthy diet, physical activity, you know, that's their foundation for life. People, when they get on that track, look at all those of us in this room, typically healthy, energetic, vibrant people. It started in a foundation. It started at a well-being, you know, 4th grade, 5th grade, 6th grade, up in those young ages. So we have to identify, get our young folks, our adolescents on the right track at the right time and set that foundation for their future. Thank you.
Thank you very much. Maine should be commended, and your leadership should be commended, because the Fund for a Healthy Maine has been dedicated for the exact purposes of the tobacco settlement. We haven't used it to balance the budget. We have used it to invest in health care, and that's extremely important. I would not divert any of these funds away. In fact, many things are underfunded. We were just talking about smoking cessation. There are very successful partnerships out there that are underfunded. So we do need a very transparent allocation process. I think all of us need to know what the priorities are. I will say that I did try to expand its use, certainly health related, for making sure that young children went to school with a breakfast, because there are many kids in Maine who cannot afford that. And we all know that you can't learn unless you're fed. Certainly this is health related. So within the spirit of the Fund for a Healthy Maine, there was a modest diversion of funds for that health related purpose. I would also make sure that the community partnerships are in tune with the public health delivery system to make sure that we're getting every possible value out of the money that we put into the Fund for a Healthy Maine. There's something that I've always found very ironic about the Fund for a Healthy Maine. It was the tobacco settlement. And in theory, pretty soon that fund would disappear. And that's the goal if we want everybody to stop smoking. But at this point, unfortunately, that has not happened. We need to make sure that we do not dilute the focus of this fund to balance a budget or anything else. But we know it needs to be focused on health-related items. And I would be a strong proponent of keeping the fund dedicated to health-related matters.
I also believe it needs to be kept for health-related matters, and I wouldn't divert any funds away from it, or in fact, I would not add any funds into it until such time as we've taken a look at what has happened over the last few years, and have we had a benefit, a return on the investment that we've made. And I believe we need to take a look at the fund, take a look at what we spent our money. Has it worked? If the results are good, we continue. If the results are not good, and we haven't been successful in achieving our goals, then I think we need to rethink it, rework it, and adjust where we need to so the funds are used properly and for their intent, and that's to make Maine healthier.
First of all, let me just say that I'm not used to being on the far right, and if those of you who can't see me, I apologize.
You're on my far left.
Want to switch?
Look, all of us agree, I think, on one important point, and that is that there should be no diverting, no dipping into the Fund for a Healthy Maine. we need to wage war on obesity and tobacco use in the state of Maine, period. And that's what this fund needs to be for. As I said a few minutes ago, 60% of what we spend on the care of chronic and preventable disease. Preventable disease. You all know this better than we do. I think there are two important points to be made about the fund. The first is that we need to focus on accountable outcomes. We need to focus on evidence-based targeting. We need to focus on the strategies that work. And the second point I want to make about the Fund for a Healthy Maine is that I think that it's time we open the doors to the MMA and to other professional organizations that are involved in this war that we should be fighting on obesity and tobacco use, and invite you into the decision-making process about how the money is used. I don't think this should be the exclusive province of the Department of Health and Human Services. I think there's a process here that's important. Your involvement's important, and I assure you that I'll make sure that that happens.
I do not support any diversion of any funds out of the Healthy Maine Fund. I will say that unfortunately, as you are all probably aware, if you visit the website of the Fund for a Healthy Maine, there's a lot of detail there about how funds have been diverted, 23% away from that into the general fund. This is a mistake. This is a policy and a practice that is indicative of the problems we have with public policy today. You know, I take a look out there as a business executive, as a person who works in the private sector, and as somebody who's very active locally in my community. And I see things like this where programs are working and they're intended for a specific purpose, and yet a diversion through national political agendas or national party politics, where someone in the legislature, someone in the governor's office feels they know a little bit better than those professionals that practice medicine in Maine every day. What occurs to me as I travel about the state of Maine is that doctors, all of you folks out there, you're losing a voice. We need to start paying attention to those people who know best in our healthcare sector. Let's inject some common sense into our public policy. Without question, I will be the single biggest advocate and welcome you into the governor's office, into the process, not as a special interest group, but as individuals who are working in the field every day. And you know, before I came out here visiting the website, I signed that pledge. And the pledge states that I endorse efforts that will keep tobacco settlement money used as it was intended and prevent further diversions away from the Fund for a Healthy Maine. And I stand on that.
Senator Mitchell, you will take the next questions. What environmental issues do you believe are important to address because they impact human health? And what steps would you take to reduce the impact on human health caused by global climate change?
Toxics in our environment are clearly a huge threat to public health and public safety. We think of bisphenol A in baby bottles and sippy cups. We think of mercury in our waters and in our fishways. We think of the long battle to get lead out of children's health because old homes here in Maine are coated with lead paint, and what a totally preventable problem that is for young people if we deal with those things. So we need to recognize what the public health hazards are. We need to do more research. The governor can be a leader in asking for more research, promoting more research with public and private universities and the healthcare community. And on the state level, demand cross conversations with various entities that deal with public health issues. For example, the Department of Agriculture with its use of pesticides regulations, or the Department of Environmental Protection with air and water quality. All of these things are huge impacts on toxics in our environment. So we simply cannot reduce our environmental regulations, because not only is it bad for Maine's economy, but it's a terrible detriment to Maine's health.
I personally believe one of the biggest problems that we have in this state, which we have little control over, and federal delegation has done a very limited amount of work on is air pollution. The state of Maine has an unusually high incident of pulmonary illness, and a lot of it comes from the acid rains and the winds that bring the toxics from industrial states, and we need to address that. I know that back when I was in the forest industry, you see the treetops turning yellow, and that was caused not by things that were done in Maine, but things that were done in Michigan, Illinois, Pennsylvania. And we need to make sure that at the federal level that we're cognizant of the fact that just because we're 1.3 million people, that we have a voice on what happens to our land here in Maine. I do believe the Department of Environmental Protection is very, very important. The Department of Agriculture is very important. At the same token, I believe that we need to bring common sense and best practices, best technology, and proven science. We need to make decisions based on proven science, not someone's emotional tantrum. Thank you.
Paul, I agree that environmental regulation is important. I don't understand why you want to close down the DEP, the department, and send environmental regulation to the Department of Agriculture, however. And I want to emphasize why I think that's a mistake. When I was helping Ed Muskie write the Clean Air Act, he emphasized the importance of setting ambient air quality standards at levels that would protect the public health. And he emphasized the importance in writing the Clean Water Act of having fishable and swimmable rivers and lakes. He grew up in Rumford, and he knew when he came back from the war how dirty the Androscoggin was. He lived in Waterville. He saw the Kennebec. Our rivers and lakes in Maine today, with one big exception, are reasonably clean. The big exception is mercury. We have a serious mercury deposition problem in the state of Maine, and most of that mercury is airborne. It comes from other states. Similarly, we have a big problem, as Paul has pointed out, with ozone in Maine. And the ozone precursors, hydrocarbons and nitrogen oxides, come from other states. It's not a question of going to Washington and asking for help. It's a question of forcing, through lawsuits, the EPA in Washington to go after those states and go after those emitters. We can do that, and we ought to do more of it. The other two things that deserve mention in Maine are lead paint. We still have the oldest housing stock in the United States, and we still have a lead paint problem, and wood smoke. Half of the wood stoves in use in the state of Maine today still emit excess amounts of hydrocarbons and particulates that cause chronic pulmonary disease. We've got to deal with those issues. And finally, I need to mention that the biggest water pollution problem coming down the pike in the state of Maine are municipal waste treatment plants and stormwater separation sewers. And we're going to have to deal with that with the federal government's financial help.
Without question,